Examination of lymph nodes is an essential part of clinical examination. Examination of enlarged lymph nodes gives us a clue regarding the possible area of infection. What we see in this image is one such clinical examination of lymph nodes, examination of cervical nodes. The examiner is peculiarly standing at the back of the patient and looking at the enlarged cervical nodes. Now, enlargement of the cervical nodes gives us a clue regarding possible area of infection in the head and neck region. And in this session, let's focus on the anatomy of the cervical lymph nodes, how they are organized and what is their area of drainage along with clinical significance. The learning objectives for this session are, at the end of completing this session, you should be able to describe the organization of the cervical lymph nodes, how they are arranged in different layers. You should be able to describe the drainage area of each of these groups, and then what is the clinical classification of cervical nodes and why we need to know this. What is the clinical significance of knowing the anatomy of cervical lymph nodes? Let's begin with the organization of cervical lymph nodes. In order to understand this organization, we have to take a transverse section of the neck at, let's say, the region of the pharynx. The entire cervical nodes are arranged in 4 distinct layers. I'll repeat again. The entire cervical lymph nodes are organized in 4 distinct layers. Now, let's try to understand these layers. We'll start from superficial to deep. So, this is the skin, right? And this is the lumen of the pharynx. From superficial to deep, these are organized as the outer ring or outer layer of lymph nodes. Then we have the middle group, which is very peculiar. They are arranged around a vein. What vein that could be? Internal jugular vein. And these are characteristically referred to as the deep cervical nodes. Fine. Then, what is the third group? Inside the deep cervical nodes, we have one more layer. This is referred to as the inner ring or the inner group. So this is outer ring or the outer group. Then inside this, we have submucosal aggregation of lymph nodes or lymphocytes like this or this. These are referred to as the innermost group. And the innermost group is otherwise referred to as the Waldeyer's ring. So this is what we need to understand first. So the organization of all the lymph nodes of the neck in the form of a ring surrounding the pharynx. First is the outermost layer beneath the skin and superficial fascia. Then we have the deep cervical nodes. Then we have the inner group. And then we have the innermost submucosal group, otherwise referred to as Waldeyer's ring. Now we have a clue about the organization. Let's try to learn about these lymph nodes in detail now. This is a surface view or profile view of the lymph nodes. What we need to identify here is, we need to identify the deep cervical nodes. Let's try to identify them. As I mentioned, the deep cervical nodes are organized around a vein. What is that vein? Yes, that is the internal jugular vein. Now we can see different groups of lymph nodes which are arranged along the course of internal jugular vein, and all those group of lymph nodes are referred to as what? They are referred to as the deep cervical nodes. And whatever lymph nodes you see here below the mandible or below the chin, here below the mandible, here in the anterior group, here in the posterior part of the neck region, all of them belong to the outer group. Fine. So this is the organization of cervical lymph nodes when we see it in profile view or surface view. Let's begin our discussion with deep cervical lymph nodes. As we defined already, deep cervical nodes are those which are situated along the course of internal jugular vein. Now these nodes are broadly grouped into 2 subdivisions. Fine. So deep cervical nodes are broadly grouped as upper group and lower group. Now how exactly they are divided into upper group and lower group? we can see two muscles here. What are these muscles? Now, can we identify this? This is the digastric muscle, and here we have the homohyoid muscle. So, the homohyoid muscle basically divides the entire lymph nodes into two distinct areas or two distinct groups. Now, what are these groups? Now, these are, can we see this? This is referred to as the jugulo-digastric nodes. Then, we have few nodes lying deep to what muscle? The homohyoid muscle, the intermediate tendon of homohyoid. And what group are these lymph nodes? Now, these are the lower group, also referred to as jugulo-homohyoid nodes. Right? So, these are the two major groups of deep cervical nodes, jugulo-digastric, jugulo-homohyoid nodes. If we observe the drainage areas, where are they draining from? If we take, the afferent is coming from the submandibular nodes, the submental nodes also, but the principal lymphatic drainage of jugulo-digastric node is this structure. What is that? This is the palatine tonsil. Fine. So, jugulo-digastric nodes are otherwise known as the principal nodes of palatine tonsil. In case of infections of palatine tonsil, these are the first nodes to get enlarged. If you had tonsillitis ever in your child life, the clinician would have palpated in this region for something. He was looking for the enlarged jugulo-digastric nodes. So, jugulo-digastric nodes are the principal nodes that drain the palatine tonsil. Even if you forget every other area, you should not forget palatine tonsil. Similarly, when we talk about the jugulo-homohyoid or the lower group of deep cervical nodes, if we observe, it is draining the lymph mainly from the tongue. So, jugulo-homohyoid nodes, these are known as what? The principal nodes of tongue. So, the homohyoid group, principal nodes of the tongue. The jugulo-digastric group, what are they? They are the principal nodes of palatine tonsil. If you know this much regarding the deep cervical nodes, it will be enough. Right? Then, let's focus on the outermost group now. That is the superficial group. Let's begin with the submental lymph nodes. Now, what are these? This is our submental lymph nodes. Referred so because they are present beneath the chin. Now, what is the area of drainage? Remember, for each group of lymph node, these are the headings which you should know. Where they are located. Where is the afferent lymph coming from? And where is the efferent lymph going? If you know this much about every single group of lymph nodes in the cervical region, this is how we can learn it better. Submental lymph nodes are present below the chin. As we can see, they are receiving lymph mainly from what region? They are receiving the lymph from tip of the tongue. Fine. So, that is regarding the efferent, tip of the tongue. Then they drain the floor of the mouth. As you can see, the floor of the mouth. Then they also receive lymph from the central part of lower lip. Now, remember this important thing, the central part of lower lip. All of that efferents will go to submental lymph nodes. If you observe, the efferent is coming where or going where? The jugulo-homohyoid nodes or the principal nodes of the tongue. This is regarding the location, afferent and efferents of what group of lymph nodes? Submental nodes. Similarly, let's see about the submandibular lymph nodes. So first, let's try to locate it. Okay, again, the location. So where are they located? This is the location of the submandibular lymph nodes. Then we should know the afferents and efferents. Where is the afferent coming from? If you observe, it is coming from again the tongue. So submandibular lymph nodes mainly receive their afferent lymphatics from the tongue and also from the floor of the mouth. That is regarding the afferent. Where is the efferent going? If you observe, the efferent from the submandibular nodes are going in two distinct directions. One is to the jugulo-digastric nodes, and one, if you observe, it is coming to jugulo-homohyoid nodes. Fine? So lymph from the tongue will first come to submental nodes, and from the submental and submandibular nodes, it will go to either jugulo-digastric or jugulo-homohyoid nodes. This is regarding the submandibular nodes. Then let's move on to the next group. What is this? This is our parotid group. As the name suggests, where it should be located? It should be located close to the parotid region. Now this is our parotid nodes. So that is regarding the location. They are located in parotid region. What about the afferents? The entire parotid group of lymph nodes is organized in two distinct parts. One is the superficial part and the other one is the deep part. The superficial part of parotid nodes is also referred to as preauricular nodes. So remember, the superficial part of parotid lymph nodes are referred to as preauricular nodes. As we have learned, preauricular nodes will drain the lateral part of the scalp, anterior and lateral part of the scalp region. Then we have the deep group, which will receive afferent from the entire parotid gland itself. What about the efferents? If you observe, the efferents are coming to where? What node is this? Yes, that is our jugulo-digastric nodes. Right? This is regarding the parotid lymph nodes. Then, the next group is the mastoid lymph nodes. This is like the exact opposite of parotid nodes. Now observe it again. The location is, where are they located? Just behind the ear over the mastoid process. That is our mastoid group of lymph nodes. Also known as, because of their position behind the ear, they are referred to as retroauricular nodes. Again, we'll try to recall what are preauricular nodes, the superficial part of parotid nodes. This is the mastoid node location. What about the afferents? It receives the afferent from posterior part of the scalp. Preauricular nodes receive it from anterolateral part of the scalp. Where is the efferent going? If you observe, the efferent is going again to what node? So that is our jugulo-digastric nodes. Right? So this is what we need to remember regarding mastoid lymph nodes. Then let's move on to the next group. This is our occipital group. So where is the occipital group located? It is located in the occipital region, back of the head. What about the afferents? Again, it will receive afferents mainly from what? The posterior part of scalp. Where are the efferents going? If you observe the efferents for occipital lymph nodes, you can see that they are draining into the jugulo-homohyoid nodes. Right? So this is regarding what group of lymph nodes? The occipital lymph nodes. Then let's move on. Let's see about the superficial cervical lymph nodes now. Where exactly these are located? So superficial cervical lymph nodes are located along the course of external jugular vein. We have learned that the deep nodes are located where? Along the course of internal jugular vein. So superficial cervical nodes, remember, they are located along the course of external jugular vein. What about the afferents? They mainly drain their afferent or receive their afferent from the superficial part of the neck region. Where is it going? The efferent, if you observe, is going to one important node here. And what is that node? That is our supraclavicular node, which lies below the jugulo-homohyoid node. This is regarding the superficial cervical lymph node. Then, we have anterior group of cervical nodes. The position itself says this is the anterior group. Right? Now, what about the location? The anterior group of lymph nodes, as we can see, is located in the anterior cervical region. Most of these nodes are located in the muscular triangle. Then, what about the afferents? Afferent is mainly from the superficial structures of the front of the neck. Then, where is the efferent going? The efferent ultimately goes to this node, that is the supraclavicular node. Right? So this is regarding the anterior cervical lymph nodes. Then, once we have learned this, let's focus on the inner circle. Of course, in this image, it is difficult to make out the inner circle. Now, imagine if we have, let's say, the trachea drawn over here. The lymph nodes present in front of it, they are referred to as pretracheal. Then, lymph nodes located on either side of the trachea, they would be referred to as paratracheal. And lymph nodes which are situated deeper in the neck, behind the pharynx, those are referred to as retropharyngeal lymph nodes. Now, these pretracheal, paratracheal and retropharyngeal nodes are located around the viscera of the neck, like tongue, pharynx and larynx. So that is what they basically drain. They drain the internal organs like the tongue and then trachea and pharynx. Lymph from these organs will drain to pretracheal, paratracheal and retropharyngeal lymph nodes. Apart from the inner circle, one important thing that I mentioned in the beginning was Waldeyer's ring. Now, what is this Waldeyer's ring? Waldeyer's ring, remember, refers to the innermost circle of lymph nodes. This is the innermost circle of lymph nodes which surrounds the pharynx. That is the location of Waldeyer's ring. One more peculiarity is these are submucosal aggregations. So this is one important thing you want to remember. Waldeyer's ring is submucosal collection of lymph nodes. It is formed by different group of lymph nodes. What are they? Now we can easily say anteriorly we have the lingual nodes. Fine. Where are the lingual nodes situated? Posterior 1/3 of the tongue. On lateral side of the tongue we have one group, that is what? Palatine tonsil. And then slightly posterior to it we have one more group, that is what? Tubal tonsil, which is located at nasopharynx. And again in midline posteriorly we have one more group of lymph node, and that is our nasopharyngeal tonsil. So if we connect these are present around the pharynx. Fine. So this is our Waldeyer's ring. Again I'll repeat. Anteriorly formed by the lingual tonsil present in the posterior 1/3 of the tongue. Laterally it is formed by two groups, palatine tonsil and tubal tonsil, present in oropharynx and nasopharynx. And then we have the nasopharyngeal tonsil, which itself is present in roof of the nasopharynx. So this is regarding the innermost group. Fine. So this is regarding the deep cervical nodes. Once we have learned this, we need to know why we need to know regarding the classification or details of anatomy of the lymph nodes in the cervical region. Clinically, the cervical lymph nodes can be grouped as group 1A or 1B. Now, what is 1A and 1B? Remember, 1A, what is the position representing? These are submental lymph nodes. So, 1A refers to submental lymph nodes. What about 1B? It is submandibular. So, this is submandibular. Right? Then come to 2A. Now, what about the 2A? If you observe 2, 3 and 4, they are in same line. So these are referred to as upper jugular. This is middle jugular, and fourth will be known as lower jugular group. So 3A, 2A and 2B refer to upper jugular, 3 middle jugular and 4 as lower jugular. Then we have 5A and 5B. These are collectively referred to as the posterior triangle group or simply posterior group of lymph nodes. Then we have group 6. This is referred to as the anterior cervical nodes. This is how the lymph nodes of the neck are clinically classified. Why you need to know clinical classification? There is a procedure referred to as block dissection. What do you mean by the block dissection of the neck? It involves removal of deep cervical nodes to prevent metastasis occurring from the cancers of the lip or the tongue. So, to do block dissection, you need to know the clinical classification, where exactly the lymph nodes are located, and you need to take out all of these lymph nodes. Otherwise, what happens is, you might retain some of the lymph nodes which will act as seed for further metastasis. That is why knowing the location of deep cervical nodes or the entire organization of cervical nodes becomes clinically relevant. This is regarding the clinical classification. To quickly summarize, we have learned that the cervical lymph nodes are arranged in 4 distinct layers from superficial to deep. These are, first we have the outermost layer, which is the most superficial layer. Then we have the deep cervical nodes. The deep cervical nodes are located along what? Internal jugular vein, course of the internal jugular vein, and are further grouped as what? Jugulo-digastric, also known as the upper group, and then jugulo-homohyoid, which is known as the lower group. Then we had the inner layer or inner group formed of the pretracheal, paratracheal and retropharyngeal nodes. Then the fourth and the most deepest layer was, or the ring was, the Waldear's ring. And what was the peculiarity of Waldear's ring? It was referring to submucosal aggregation. Submucosal aggregation of the lymphatic tissue. So this is how the lymphatics or lymph nodes of the neck are organized. We learned that each group has a location, has afferent and efferent. The primary efferents either drain to the jugulo-digastric nodes, jugulo-homohyoid nodes or supraclavicular nodes. Knowledge of location and afferent or efferent area of these nodes is essential to do a surgical procedure known as the block dissection of neck, which is done very often to prevent the spread of cancer or metastasis of cancer from the oral or the lip or the tongue region. This is regarding the anatomy and clinical significance of knowing the anatomy of deep cervical nodes. That's it for this session.